Hi, I'm Dr. Santoshi. Today I'll be discussing about how psoriasis and depression are related and what we can do to help our patients who have both. Now, like I said, psoriasis is a chronic inflammatory condition which has skin manifestations, but the effects spill over to other systems as well, the central nervous system, the cardiovascular system. So, when we have a pimple, many of us wake up with an acne before an important event and we feel really upset. It's a very devastating thing. So we look up our dermatologist and then we go and get it treated at the first possible instance. Many of us sometimes do not attribute this level of, we do not give them this level of seriousness to even other illnesses. We may have some cholesterol issues or we may be having vitamin D deficiencies, but we cannot see it, right? In person, in flesh. So it doesn't occupy the same importance as what a skin disease occupies in our life. So that said, now psoriasis, as we know, it's characterized by large, areas of silvery red lesions which are scaly, okay, with silvery scales, and they are red and they are itchy. Some of them are fissured, some of them are bleeding. It affects the scalp, it affects the nails, and so can you imagine the consequence that psoriasis can have on someone's psyche, that matter, right? So we have a pimple, we go out with a pimple patch. Now we have large areas of our body covered with scales. What are we supposed to do? Do we really go out of the house with the same confidence that we would if our skin was clear? Would we go to the job interview with full confidence that yes, we'll do a good job and there's a good chance that we get the job offer? Even if we get the job offer, will we go to work regularly even if we have a psoriasis flare? The answer is probably not, right? So psoriasis wreaks havoc on a patient's lifestyle, quality of life, productivity, the satisfaction in intimate relationships. So now psoriasis and depression. Now depression, I hope none of you have experienced it. I have experienced it personally, and so depression is, it feels sometimes, I don't even know how to put it in words, it feels sometimes like a big dark cloud always hanging above your head. It's there in the periphery. No matter what you do, you may be having a good time with your family, you may be in a movie theater, you may be at a restaurant, you may be shopping, but there's always this sense of heaviness in your heart. I mean, at least that's how I can, describe my personal experience with this illness. And like I said, 1 in 4 people can suffer from one or the other form of mental illness. So depression ranks up there, followed by anxiety. So depression can literally rip the joy out of your life, right? And psoriasis and depression, they have a strong correlation in the sense people with psoriasis have also been found to suffer from depression more often than people without. So every patient of psoriasis has to be inquired about their wellness. They have to be asked, do you feel like you do not have energy to do the things that you love? Do you feel that the pleasure that you used to get out of doing things you love is not there anymore? Okay, focus on the DSM-5 criteria that lists out the symptoms of depression, the diagnosis criteria. I think we can all make ourselves familiar with the DSM-5 criteria to diagnose depression, even if you're not psychiatrists. So at least we can focus on what questions to ask our patients with psoriasis so that we do not miss out. Sometimes the patient who is suffering the most appears to be smiling, okay? So the people who suffer the most sometimes do so in silence. So it's up to us to kind of dig, break past those barriers, because these are patients that have been shamed, that have been, sometimes even marginalized by society because they think it's contagious. So these are patients who will not be forthcoming to discuss what they're feeling, least of all to a stranger who they just met. So creating rapport, in establishing trust, the patient, the moment they know that you care, they will open up. The floodgates will break down. And also, if you're familiar with the DSM-5 criteria to diagnose depression, we'll also focus on the concrete questions to ask. So you can ask about constant guilt, constant shame, loss of productivity, loss of pleasure in previously pleasurable activities. That's called anhedonia. So all these things, and then of course refer them to the experts, the psychiatrist, the psychologist. And I have found that the moment the patient also starts focusing on their mental health, not just on their skin health, both improve. The mental health improves, and that reduces stress levels, that reduces the inflammatory markers circulating in the system, that reduces cortisol, that reduces the severity of psoriasis. and the patient also has an improvement in their mood, okay, and also has an improvement in their quality of life. At the end of the day, we are trying to treat their psoriasis to improve their quality of life, right? So we have to, address this aspect of a patient's life in every patient of psoriasis especially. Okay, some of our treatments, they go on and on and on. They're also pretty expensive. So we should also inquire that aspect of the patient's life. We should make sure that our treatments are affordable by the patient, so that does not add to their stress. How are they going to procure these expensive medications? Okay, so if we have a structured SOP, a standard operating protocol as to how we deal with the patient who walks in to our OPT with psoriasis, be it for the first time or be it for the 18th time, because let's face it, most of our patients are chronic patients. We end up forming, sometimes a little bit more than just a professional rapport, because you see them for years together, right? So it's very, very important and cannot be downplayed. All right, like I said, if any patient with psoriasis, you find that they also have comorbid depression, you diagnose them with your, as a dermatologist, not as a psychiatrist, with your limited psychiatry knowledge, that you're able to identify that something is not quite right. Do not ignore that feeling, because a patient may have frequent suicidal thoughts. Imagine inflicted with a chronic skin condition, and there's a lot of stigma associated with it, okay? And you also have some other comorbidities going on. So imagine the patient comes to you with that. So you have to actively seek out if the patient is, thinking of ending their life, okay? Because suicidal tendencies are common in patients with skin diseases itself, and especially in patients with chronic illnesses, any chronic illness for that matter, psoriasis, vitiligo, okay? They may not be life-threatening illnesses, so to speak, but they can threaten life in ways like this, okay? So you have to actively ask if the patient, is giving you a hint that the patient is depressed. Always ask, have you ever, thought of ending your life? Have you ever thought that life is not worth living? You don't have to outright, not accuse them, outrightly ask them, are you feeling suicidal? Patients will back off, they will shut down. You have to ask them in a very delicate manner, have you ever thought that, it's better to end your life? Have you ever felt very hopeless? That loss of hope is the one thing that's a big red flag in your consultation. When the patient says, I'm feeling hopeless, that is the time that your radars should perk up and should catch that frequency. The patient is crying for help in as subtle way as possible. So all our dermatologists should be trained in identifying the red flags, okay? Because we deal with patients with mental illness, so we should know what mental health emergencies are at least, okay? So we should be very, very careful and refer them to a psychiatrist. Of course, anybody who has suicidal ideation, it's a psychiatric emergency, so refer them to the experts to deal with. As dermatologists, what we can do is first of all make ourselves aware of what a patient with psoriasis actually goes through in their day-to-day life, okay? And the profound psychosocial impact of psoriasis, and basic questions that we can ask our patients to find out about their mental health, and if they suffer from any form of mental illness, to find out if they're compliant with their medications or therapy, and if they're taking their mental health seriously. Encourage the patient to take their mental health seriously. Tell them there is no shame in suffering from mental illness, and of course look out for any red flags or warning signs that the patient requires expert care urgently.